Today we're answering the frequently asked question, is LASIK permanent? If you're considering LASIK or any vision correction procedure, you of course want to know how long it's going to last. In this video, we're going to answer that question and more. Don't forget to like and subscribe to our channel for more information on modern vision correction. Let's get started. To learn more about modern LASIK and other vision correction procedures such as EVO ICL, custom lens replacement, and more from some of the top vision correction specialists in America, and to find a surgeon near you, like and subscribe to our channel and visit bestlasicsurgeons.com. Okay, so is LASIK permanent? Yes. The changes that LASIK makes to your cornea are permanent, but does that mean your prescription will be fixed forever and that you'll never need glasses again, even when you're 90 years old? To discuss how long you should expect to be free from glasses and contacts after LASIK, we need to go over some basics about how the eye works and about how LASIK works. In LASIK, a laser is used to change the shape of the cornea. The cornea is the clear lens on the outside of the eye. The curvature of the cornea is an important factor in determining the prescription of your eyes. By changing the cornea's shape, we can change your prescription. So how does the laser change the shape of your cornea? The laser does this by what's called ablation. The laser uses light waves, which you don't feel at all, to literally vaporize away a thin layer less than a millimeter from the inner part of your cornea. If you're nearsighted, the laser removes a little bit more from the center of your cornea to flatten its curvature. If you're farsighted, the laser removes a little bit more from the periphery of your cornea to steepen it. It's that change in curvature that determines the change in your prescription. Again, the changes made to the cornea during LASIK are indeed permanent. However, this does not mean that your vision will remain perfect forever. The stability of your vision post-LASIK can be influenced by several factors. Let's discuss what they are. Age-related changes. As you age, your eyes naturally undergo changes. These changes occur in both younger patients and in older patients. In younger patients, LASIK is generally not performed under the age of 18. We want to make sure the eye has stopped growing so that you get the most longevity from your procedure. For many, the eye stops growing by age 18. But for some patients, they may have to wait a little bit longer. Generally, between the age of 18 and 45, the prescription doesn't change very much. As patients approach 50, the natural lens starts to stiffen, which will cause a loss of the range of vision. This is called presbyopia, and it's the reason that older patients need reading glasses or bifocals. There are strategies for patients in their 40s, 50s, or even older to have LASIK to decrease their dependence on both distance glasses and reading glasses. This is called monovision or blended vision. We won't get into those details in this video, but if you're in that age group and considering a vision correction procedure, this would be something to learn more about. So if you have LASIK between the ages of 18 and 45, most patients remain free from glasses or contact lenses until somewhere around the age of 45, at which point they'll gradually start needing reading glasses. However, most of these patients continue to have excellent distance vision without needing glasses or contacts for their distance vision activities, like driving, watching television, seeing a golf ball, or other outdoor activities. Eventually, if you get old enough, you will develop cataracts. Cataracts are when the natural lens inside the eye becomes cloudy. During the process of cataract development, your prescription may drift. Generally, this happens in the 60s and beyond. However, everyone is different, and it's possible that younger patients, although less commonly, can develop cataracts, even babies and children. But again, this is not common. So for the average nearsighted patient in their mid-20s, it's common to get decades out of your LASIK, where you're totally free from glasses or contact lenses until presbyopia sets in and you start needing those reading glasses in the late 40s and early 50s. Regression. In a small percentage of cases, a mild drift in prescription can occur back towards your original prescription. This is generally very uncommon in nearsighted patients, and the vast majority of patients who have LASIK are nearsighted. Farsighted patients, particularly with higher prescriptions, are at more of a risk for regression than others. For most patients who have regression, a simple touch-up can be typically done to treat the remaining prescription. It's rare for patients to need more than one touch-up. However, everyone is different. And if you are a patient with an extreme prescription, especially a farsighted extreme prescription, you might be more at risk for this. Regardless of your prescription, an important question to ask your doctor during your consultation is, what's my risk for regression? And if I have regression, will I be a candidate for a touch-up? Again, everyone is different. So, as an example, if you're nearsighted and you have say a very high prescription, like -10, and your corneas are of borderline thickness where you might still be a good candidate for LASIK, but you might not have enough corneal thickness remaining afterwards for a touch-up if you need it. In these situations, you may be a fine candidate for a PRK touch-up, or an alternative to LASIK in this case. Or instead of having LASIK as your original procedure, a better option might be the EVO ICL implantable contact lens. The key thing to remember is that every patient is different, and modern vision correction is not a one-size-fits-all procedure. So that's it. We've discussed a number of important topics, such as, are the changes to your eye made during LASIK Permanent? Yes. How long should you expect to be free from all glasses and contact lenses after LASIK? Well, in general, this depends mostly on age, but we also discussed risk factors for regression. And we also talked about the normal age-related changes to the eye. We hope you found this helpful. Like and subscribe to our channel. And for more educational content about modern vision correction, check out our website, bestlasicsurgeons.com.